Sciatic nerve. In this video, we'll understand the sciatic nerve step by step. First, its origin from the sacral plexus. Then, its course through the pelvis, gluteal region, and thigh. Next, the relations and how it lies with nearby structures. After that, the branches it gives off. And finally, some important clinical points you must know. Let's begin. The sciatic nerve is the thickest nerve in the body. It is about 1.5 to 2 centimeters, wide at the beginning. It arises from sacral plexus in the pelvis and consists of two parts, tibial part and common peroneal part. The tibial part is formed by the ventral divisions of anterior primary rami of L4, L5, S1, S2, and S3. The common part is formed by the dorsal divisions of anterior primary rami of L4, L5, S1, and S2. The two parts are usually enclosed in a common sheath of the connective tissue. Extent: it begins in the pelvis and terminates at or just above the superior angle of the popliteal fossa by dividing into tibial and common peroneal nerve. Course: in the pelvis, it lies in front of Piriformis, under cover of its fascia. It enters the gluteal region through greater sciatic foramen below the Piriformis. Here it runs downward with slight lateral convexity and passes between the Ischial tuberosity and greater Trochanter. It enters the back of thigh at the lower border of the Gluteus Maximus and runs vertically downward, just above or at the superior angle of the Popliteal fossa, approximately at the junction of upper 2/3 and lower 1/3 of the back of thigh. It divides into two terminal branches, that is, tibial and common peroneal nerves. Variations in the mode of exit of the sciatic nerve from pelvis. Normally, the sciatic nerve enters the gluteal region through greater sciatic foramen below the piriformis. Sometimes, sciatic nerve divides into tibial and common peroneal components within the pelvis. In such cases, the mode of exit from pelvis occurs as follows. The common peroneal nerve passes through the piriformis, and tibial nerve passes below the piriformis. This occurs approximately in 12% of cases. The common peroneal nerve passes above the piriformis, and tibial nerve passes below the piriformis. This occurs approximately in 0.5% of cases. Relations: deep relations that is also called as bed of the sciatic nerve. From above downward, the sciatic nerve is related to body of ischium, that is posterior surface, tendon of obturator internus, quadratus femoris, adductor magnus. Superficial relations. From above downward, the sciatic nerve is related to gluteus maximus in the gluteal region, long head of biceps, femoris in thigh. The sciatic nerve is accessible on the back of thigh only in the angle between the gluteus maximus and long head of biceps femoris. Branches: articular branches to the hip joint arise in the gluteal region, Muscular branches to the hamstring muscles arise in the lower part of the gluteal region. Muscular branch to the short head of biceps femoris arises in the lower part of the thigh from the lateral side of the nerve. Muscular branches of the sciatic nerve arise from the medial side, except nerve to short head of biceps, femoris, which arises from the lateral side. Therefore, the side lateral to the sciatic nerve is safe side, and the side medial to it is dangerous side. Sleeping foot. The sciatic nerve is uncovered on the back of thigh, in the angle between the lower border of Gluteus Maximus and long head of biceps femoris. The temporary compression of the sciatic nerve against femur at the lower border of Gluteus Maximus causes paresthesia in the lower limb. It is called sleeping foot. And that's the sciatic nerve, the largest nerve of the body. Simple and clear. Thanks for watching.